because here I see that there's an order to start an IV with normal saline, which makes sense. She had a GI bleed, so we just want to replenish those fluids. Now that I've looked over that, I'm now going to go gather all of my supplies here, which I have just done so. And then next I'm just going to go over to the medication room. I'm looking for normal saline, which I found right here. I'm just going to do 2 medication checks. So I see that I have the right fluid here, sodium chloride. It is not expired. Color is good and it is clear. And I'm going to do a second check of that. Sodium chloride, it is not expired. It's nice and clear and the color is good. So now that I have done that, I can now go into the patient's room. Knock, knock. Hello.
Hi.
Hi, I'm Shelby. I'm going to be your nurse today. I'm going to do some hand hygiene. Also provide for privacy. Before I get started with anything, can I get your full name?
Yes, Emma Rodriguez.
Okay. All right, and your date of birth?
4/22/19.
Okay, all right. And do you have any allergies?
Yes, iodine.
All right, and to iodine. And what's your reaction to iodine?
I just get hives.
Okay, all right. All right, I have that here on your chart. Okay, so today I'm going to be giving you an IV. I'm just going to be giving you some normal saline just to help replenish some fluids for you. Do you have any questions on the procedure?
Nope.
No questions? Okay, great. All right, so now that that is done, I'm going to go ahead and do my third and last medication check. And just see that I have normal saline here, right drug or right fluid, not expired, and it is colorless and clear, which is great. So then I'm going to label that with a patient's name, date, time, and my initials. All right. Up next, I'm going to open up the IV administration set. And then I'm going to immediately close the clamp for this guy. Once I untangle her. Alright. Closing the clamp. And then I would label this tubing with the date, time, and my initials as well. And then normally this would have a cap on it, so I would just take that off. Same with my IV bag, and I'm just going to spike the IV solution. Alright, great. I'm just going to hang that up. And I'm going to fill the drip chamber up to halfway. Looks good. Alright, and then I'm going to remove all of the air bubbles here. Unclamping the tubing here. I've had trouble with this tubing before. There's no clamps in here that are clamping this tubing, but I would normally make sure I have proper tubing. I would never use something like this, but for this situation, this is what I have. So I would make sure that all of the air bubbles are out of here before putting this cap right back on. All right. So I'll set that there. All right, next I'm going to arrange all of my supplies. Bring it over. And then I'm going to make sure there's adequate lighting. I'm going to raise the bed to a good working height. I'm going to lower the side rail and then arrange all of these. All right. Do you have a preferred IV site?
Yeah, left arm, please.
Your left arm right here?
Yep.
Okay, perfect. I'm going to prepare some tape. Just to be safe. next I'm going to flush the extension tubing, and I'm going to get rid of the air in this here by pulling down and then going right up. All right, looks good. And then I'm just going to attach that to the extension tubing here. All right, perfect. And then I'm just going to flush the extension tubing here with the normal saline, making sure all air bubbles are out. Perfect. All right, just gonna leave that here for now. Okay, and then I also picked out an appropriate size catheter. This is a 20 gauge right here. Okay, now I'm going to palpate. Now I'm applying this tourniquet 4 to 6 inches above the intended site, and I'm just going to palpate for a vein. This one feels really good right there, so I'm going to go for that one. I'm going to release the tourniquet, and then now I'm going to don on some gloves, and I'm going to apply some chlorhexidine to the site and also prep my catheter. So I'm gonna squeeze the sides here and clean the site rigorously for 30 seconds. 30 seconds has elapsed. Toss that. And I'm gonna wait 30 seconds to a minute till this is fully dry. In the meantime, while I wait, I'm going to prime my catheter here. And by doing so, I'm just rotating 360 degrees. Like that. All right. Now I'm going to safely recap, maintaining aseptic technique. All right, perfect. Now that I have done that and the site has dried completely, I've waited 30 seconds to a minute and it is now completely dry. I'm now going to reapply a tourniquet right there. Ooh, let's do it again. Nice and tight. There we go. All right. And here I'm going to make sure the bevel is up. I have a clear view of the flashback chamber. I'm going to be going 30 to 45 degrees. I'm going to be putting some traction down here on below the vein, and 30 to 45 degree angle. I'm just going to go smoothly right on in. All right. And I'm going to lower right here. I see red. I'm going to pull blue. I'm then going to advance the hub here, and then I'm going to apply some occlusion pressure, my non-dominant hand, and I'm going to some gauze here, and I'm going to immediately have my extension tubing go right here. Perfect. All right, now I'm just going to hold it in place. I would clean the area as needed, and then I'm just going to flush with normal saline. I'm going to be looking for any signs of infiltration. I'm going to be doing 3 to 10 milliliters, but with this balloon, it will overinflate, so I'm just going to verbalize that I do 3 to 10 milliliters looking for infiltration, which I do not see, which is good. And then I'm going to remove this. All right, and I can dispose of this in the sharps. All right, and now I'm going to apply some tape. Right over here. Perfect. You doing okay?
Yep, doing great, thank you.
All right, that didn't hurt too bad, did it?
Nope.
Okay, great. All right, now that I have done that, I am going to attach the saline here, I'm going to make sure to scrub the hub before doing so. Actually, I'm going to apply this occlusive dressing. And on this dressing, I'm going to make sure that I have the patient's or the date of birth, time, and also my initials and the gauge of the catheter I use, which I used a 20 gauge catheter. And so I'd go over right just like so with that. All right, now that we're done with that, I'm then going to scrub the hub of the catheter. Get this out of the way. All right, I'm gonna be scrubbing here for 30 seconds. Make sure that area is good. 30 seconds has elapsed. And then I will now attach it here. I'm gonna make sure my clamping is off and attach right here. There we go. Perfect. And then I'm just gonna tape that right on to the patient's arm here. All right, does that feel okay?
Yep, feels great.
All right, great. And then I'm just going to set the drip rate per my calculation, and then unclamp the tubing here based off that. And then I'm going to move all my supplies here. All right. And then I'm going to place my patient in a position of comfort. I'm going to raise the side rail, lower the bed, and then I'm also going to check back on my patient in 10 minutes, look for any signs of infiltration, check the drip rate, and also to see if they're having any pain or anything like that. And lastly, I'm going to document for that, and that's my last step. All right, so everything's good. Now I'm going to perform hand hygiene and leave the room. All right. Now it is 2 days later, and I have an order to discontinue the IV fluids, and to do this so when the patient is awake and gag reflex returns. So I will assess to make sure that is already done. Okay, all right, and I'm gonna gather my supplies. I just have some saline here and some alcohol swabs. I'm going to now enter the patient's room.
Hi.
Hi, I'm Shelby, I'm gonna be your nurse today. I'm gonna perform hand hygiene, provide for privacy, make sure there's adequate lighting. All right, before I get started with anything, could I get your full name?
Emma Rodriguez,
All right, and your date of birth?
4/22/19XX.
Okay, great. And do you have any allergies?
Just to iodine.
To iodine, and what kind of reaction do you have?
I get hives.
You get hives, okay. All right, I have that already charted here. All right, so today I'm just going to be converting to an intermittent access for you. So basically I'm just going to be discontinuing you off your IV, but we're still going to keep that access there for you. Do you have any questions on the procedure?
Nope.
All right, now I'm going to lower or raise the bed, lower the side rail, and put my patient in a position of comfort for this procedure. I'm going to don gloves. So I can use one of these alcohol pads to assist in me removing the tape here. I'm gonna make sure the IV clamp is closed, which it is right now, and then remove this here, and I can use alcohol to help me with this. All right, just like that. I'm gonna remove here. And then I would dispose of this per hospital policy. And now I'm going to get a new alcohol pad, and I'm going to wipe off the top. Actually, I'm gonna grab a new pad here. I'm gonna do the saline first. All right, so I'm gonna get rid of the air here. Go up, perfect, now it's ready. Okay, and then now, let's scrub the hub there. Okay, scrubbing the hub for 30 seconds here. 30 seconds has elapsed, so now I'm going to attach the flush here. All right. And now I would just be flushing 3 to 10 milliliters, but again, it's a balloon, I don't want to overinflate it. But that's how much I would do. I'll be looking for any signs of infiltration here, and I don't, so I'm going to go ahead and clamp here before I remove the saline here. All right. And now I can go ahead and dispose of this and the sharps and dispose of all of my supplies per policy. And I'm going to make sure I, hand hygiene, I'm going to raise the rails, lower the bed. I'm going to make sure there's a call light, and I'm going to also document on the procedure. And if you have any other questions or any needs, just let me know.
Okay, thank you.
All right, thank you. All right, going to perform hand hygiene as I leave the room. All right, now it is 1 day later, and I see an order to discontinue the IV for Miss Rodriguez, which makes sense. She's post-op and she's ready to be discharged soon here. All right, so I'm going to go ahead and gather my supplies. Just need some alcohol wipes, some gauze, and some tape. All right, knock knock.
Hi there.
Hi, I'm Shelby. I'm going to be your nurse today. And I'm going to wash my hands, provide for privacy. Before I get started with anything, can I get your full name?
Emma Rodriguez,
All right, perfect. And your date of birth?
4/22/19XX.
All right, and do you have any allergies?
Iodine?
To iodine. What kind of reaction do you have to iodine?
I just get a rash.
A rash. Okay, great. All right, I have that listed here. All right, so today I'm going to be discontinuing your IV, so we're going to get that off of you. Do you have any questions on the procedure?
Nope.
No questions? Okay, great. All right, so I'm going to go ahead. I already performed hand hygiene. I'm going to don on some gloves. I'm also going to get this tape ready first. Just in case. All right. And I made sure to raise the bed to a good working height and lower those side rails. Good lighting is here. All right, and I'm going to get all this tape off of you, okay?
Mm-hmm.
All right, and I'm gonna use these alcohol swabs to aid me in that. So let's start right over here and from outside in. Now that everything's all clean, I'm going to gather some gauze here. And I'm just going to slowly just release the catheter. And I'm going to inspect for intactness, which it looks good. And I'm holding pressure until I make sure the bleeding has stopped. I'll dispose this per policy. And I'm just going to apply some tape to secure the dressing now that the bleeding has been controlled. All right, how'd that feel? Are you doing okay?
Yep, great.
Perfect. All right, now just dispose of all my supplies. And if you need anything else, are you good?
Yep.
Okay, perfect. All right, then I'm going to go ahead and place my patient, lower them, raise the side rail, make sure they have their call light on hand, and that's it. And then I'm going to also be sure to document all of my procedures that I've done.